Dr. Stepovich, hi. How is life? How is life? Life is good again, right?
Well, life for me is straightening out. That's all I do is straighten teeth, so it's no pun intended. But
no pun intended, huh? Okay, well, Dr. Stepovich, once you have straightened out a person's teeth, whether he's an adult or whether he's a teenager, and maybe there's a difference, you will let us know. What has to happen or what will happen? So let's say 2 years, 3 years, whatever the treatment took, 1.5 years, as I know that you orthodontists work a lot faster now than years ago. So let's just say a couple of years have gone by, braces come off. What is expected from the patient? What needs he do? What does the dentist, the orthodontist, still need to do? And for how long does something still need to happen? Tell us about it.
Orthodontic treatment, once you remove the braces, the bone around the teeth is new bone on one side where the tooth came from, and where the tooth has been moved to, it's new bone on that side too. So basically around the teeth, the bone is cartilage, like your nose and ear. And after braces are removed, it's totally required for every patient to wear a retainer to let that bone change back to normal, hard, compact bone that was there before the treatment started. And so that usually takes 3 months to get that totally done. And then in my office, I don't let the patients have retainers that they can take out of their mouth in the bottom on the bottom teeth, because I found that is where the relapses occur. The treatment that was done, the lower teeth are going to move, even if the patient has a retainer that they take in and out and wear at night. The teeth will move. And so I use fixed retainers. We have a wire that is fixed to the teeth, right on the inside of their teeth. You can't see it. Doesn't bother their tongue or speech. And it's holding the lower teeth in the proper position that they were placed at the end of treatment. And I've seen patients 20, 25 years later, and their teeth are exactly where we placed them, and they're telling me, I really appreciate having this because my friend's teeth that had orthodontics at the same time, their teeth have moved. So retention is a very, very big part of orthodontic treatment and necessary. Every treatment has to have some kind of method of getting that hard compact bone back and then holding them after that, for years. And these wires that I placed in here are actually lifetime wires. We've taken them out after 40 years, and the teeth move. And so it's necessary to wear them. And I have, of these patients, all my patients get fixed retainers in the lower. So we have, occasionally, something comes loose, and the patient has to come in on a recall appointment and get that cement placed back on a wire so that tooth it doesn't move. It's the lower front 6 teeth, and so we have 6 teeth that are glued on there, and that way we just maintain them. And most of the time we don't need an upper retainer after the first 2 years, because the teeth settle in around the lowers, and that does it. But if you let the lower teeth move, the upper tooth moves. The upper teeth are keyed to the lower teeth.
All right.
They overhang the lower teeth.
Let me get some of the major thing here straight. So, a case is finished. You put in a retainer, which is like a little wire or something, and that has to stay in it for 3 months, or did you say sometimes that has to stay in it
wire? That lower wire is a lifetime wire. It's there for a lifetime of the patient to maintain those teeth.
It doesn't bother him.
No. And there's no gum disease that's ever created by it. We have studies to prove that, and there are no cavities or anything happening there. The only thing it does is maintains the teeth in the straight position, and they don't move. The upper retainer, though, in my office, has to be worn for 3 months, and after that we go to nighttime wear, and many times we can discard that retainer after 2 or 3 years. And because the lower teeth are being held in the proper position, we don't have the teeth move in the upper either.
I see. So what you're telling me is a person wears 2 years of braces, and then and the upper one still a couple of years of a night guard, mouth guard, or whatever.
Well, it's a removable retainer,
right,
that holds the upper teeth, so that the hard compact bone can get established, and then for a couple of years to get the teeth totally settled into the lower teeth, and then we can say that we can discard the upper retainer. Now, the exception is that if you had a lot of crowding in the upper, we do put the wire in the upper also. But that's only in about 10% of the cases that I treat.
And it also doesn't bother a person?
No, it's a little different, because most of your speech sounds are made by pushing the tongue against the back of the front teeth. So you have to make that correctly and the proper, so it isn't too bulky, and that it can withstand chewing, because the lower teeth push the food up underneath the lower, in the upper teeth. So there's a lot of good sound technique that you need to have to make a proper upper fixed retainer. In the lower,
once you have it, it doesn't really bother the person.
No.
Okay.
That's correct.
Well, all right. So it looks obviously that the treatment isn't totally over 2 years after. When the treatment is over, one, like with everything else in life, needs to continue to maintain it and to do something and to give it some crutches, so to say. Very informative, Dr. Stepovich. Very informative. Thank you very much.
Thank you.